Well, as the world observes Malaria Day today, it's hoped countries will take urgent action to control the deadly disease. Malaria is life-threatening and commonly spread through mosquito bites. This year's theme is Zero Malaria, Draw the Line Against Malaria, because every malaria case is preventable and every malaria death unacceptable. The World Health Organization estimates that over 384,000 people have died from preventable malaria in the African region in 2020 alone. Let's talk more about this, then bring in Professor Tiaan de Jager, a director at the Institute for Sustainable Malaria Control at the University of Pretoria. Prof, grateful for your time tonight. So every malaria death, we're told, is preventable, but why is it then that we sit here in 2021 looking at numbers from last year where over 384,000 people died of this disease?
Good evening. Yes, malaria is an ongoing challenge. As you know, the mosquito might build up resistance. The parasites might build up resistance. There's changes in the environment. So it is a continuous struggle. We need to be creative, innovative, come up with new ideas because things that worked in the past might not work currently. So it is an ongoing battle. And yes, therefore the research and we at the University of Pretoria believe that an integrated approach towards malaria and a more sustainable way of combating malaria will eventually get us to elimination.
So how much of a boost is the news last week from the Oxford University researchers who've been conducting trials in Burkina Faso since about 2019 that the vaccine that they've been trialing there, the Matrix X, has proven about 77% effective in trials conducted on more than 400 children, infants in particular. Is that the silver bullet we've been waiting for?
I wish I could say yes, but the good thing is it is another method that we can add to the basket. So yes, it will help for sure, but on its own, a vaccine will not solve the malaria problem. We need to have an integrated approach towards it. And it's not only one single method that's going to get rid of malaria. We need to continue with the battle against the mosquito, the vector. And then here at the University of Pretoria, we had a recent breakthrough also in terms of the parasite blocking interaction. So I think to get really to elimination, it is a combination of factors, but the vaccine would be one of those methods that would really help us to get there.
Given what you've been saying about the changes in how malaria is spreading and the infection itself, do you think then that now that we're going to see further trials, now with a sample of more than 4,800 people with this Matrix X vaccine, that we could still see a very dramatic change in efficacy rates with a bigger sample?
Yes, I think it will have an improved outcome for sure. But once again, remember, we need to look at different geographical areas. There's different challenges. Some areas, the climate specifically, and we talk not only about climate change and global warming, but the environment as such is playing a significant role. The movement of people across borders, obviously. So yes, it is also a financial issue. We know that the more rural, poor areas, the disadvantaged, are the hardest hit by malaria. And therefore, we need to have a sustainable control program and not only be reliable on a vaccine.
And there's been an outpouring of financial contributions to fund COVID-19 research programs and to, of course, bring forth the vaccines that we're sitting with currently. Over the years, I mean, malaria research has been going on since, I understand, about 1940. Is there a similar outpouring of finances as far as malaria prevention methods are concerned?
I wish I could say yes, because what is happening, there's good funding until a country might get close to elimination. And then the funding dries up, and then we see that there's an increase in malaria as such. We need continuous funding because once we get to zero malaria in a specific geographical area, you need to still monitor the situation, do surveillance to make sure that it's not going to come back. So it is financially, it needs to be supported. We need to invest in things like management, leadership, not only the basics that's needed on the ground in terms of the entomology and the surveillance, or the basic or fundamental laboratory research. It is an ongoing process, and it needs good resources and funding.
Professor Tiaan de Jager with the faculty, where you are the Faculty Dean of Health Sciences and Director at the Institute for Sustainable Malaria Control at the University of Pretoria. Good to have your time tonight, sir. Thank you.